Professor Aziz Rehman from Medurstand. Today we are going to start the examination of a respiratory system. You know, examination of respiratory system should be started from the examination of hands. If you have covered this in the general physical examination, that is okay, but here you, I think, looking for two things which are very relevant to respiratory system. One is cyanosis. Now see the fingers, if there is any cyanosis. Cyanosis is blue discoloration of body, and if it is present in the peripheral part, it is called acrocyanosis or peripheral cyanosis. So I think to me this pigmentation, this color is normal, and if I am in doubt, I may compare it with my own. So this is how I do it. So there is no bluish discoloration, and there will be another detailed video on cyanosis alone. So no cyanosis. The other thing in the respiratory system which we are interested to see is the clubbing. Normally when you examine the nail like this, there should be a clear angle. You know, this is a nail bed and you can see the clear angle, and this angle may be obliterated in clubbing, and this part becomes enlarged and you can actually feel buoyancy. When you touch it like this, press it like this, you feel as if there is some spongy structure. And in typical advanced clubbing, you would have clubbing, that this part will be enlarged. So clubbing and cyanosis together is highly suggestive of a respiratory disorder or a cardiac disorder. Respiratory disorder like bronchiectasis, one example, and cardiac cause like endocarditis, like patient with phalangocytology could have cyanosis and clubbing. So whenever you see cyanosis, you are actually asked to differentiate between peripheral and central cyanosis. The difference is central cyanosis is present everywhere, whereas peripheral cyanosis is present only in the peripheries, right? In the central cyanosis, cyanosis will also be present in the peripheries, whereas in peripheral cyanosis, it will be only present in the peripheries. And when you touch the hands, it will be relatively cold in peripheral cyanosis, because that actually indicates either hypovolemia or cardiogenic shock or poor perfusion or some excessive vasodilatation. So all these conditions, there may be some peripheral cyanosis.
Medurstand. Understanding medicine.